Well, did you notice an increased uptake on the number of people wearing masks while out and about in Thunder Bay on the weekend? It wouldn't be surprising. On Friday, the Thunder Bay District Health Unit's mandatory mask policy came into effect. And to get a sense of how things are going, we're joined by Dr. Janet DeMille. She is the Medical Officer of Health for the Thunder Bay District Health Unit. Dr. DeMille, good morning.
Good morning. How are you?
I'm well, thank you. Thank you for joining us once again. So it's been about 4 days since this policy came into effect. What kind of things are you hearing?
You know what? I'm hearing some really positive things overall. I think, I myself was in a couple of stores over the weekend and even yesterday, and I was really, impressed by what I was seeing. Everybody was wearing a mask, even, following the rules as well, or the other guidelines in the stores, and the staff were wearing. And I felt, people were wearing their mask or their face covering, properly. I didn't see maybe as many noses as I might have normally seen, but, so I was really pleased to see that. And, I had a couple of people recognize me and came up to me and, sort of really showed their support for that and the kind of these kinds of measures. So, that was my impression, and I know some of my staff here were out as well, and that was their impression as well. So really, really pleased about the support, at least here in Thunder Bay, that people are showing with respect to this.
Well, that's good to hear. We were talking with the Chamber recently about how businesses have been preparing for this, and the idea that businesses are playing more of an educational than an enforcement role in this. Have you heard anything about enforcement or any kind of bumps in the road in that area?
You know what? I haven't. We're still sort of following up. We did a lot of work last week with the Chamber of Commerce and with businesses phoning in and learning, figuring out how to apply those instructions to their particular setting and their particular context. And, we're going to be continuing to do that and troubleshoot with places or, as needed to be able to ensure that we can implement this, effectively across the area. So, but I didn't really hear of any significant issues that were experienced. And I'll acknowledge that not everybody was in favor of this. Certainly in the public, we know that there are people who don't support the mandatory masking, and I've heard from some of those individuals as well. And I even think that the bulk of those people are, they have their reasons for, maybe being opposed to it, but they still are complying with it. That's there might be some people who are a little bit more imposed and a bit stronger in their actions, but I think people are generally accepting that we live in, a challenging time with this pandemic, that our communities and are can be impacted by this, especially, looking forward into the future. And I think people are, willing to take these measures to help reduce the spread and to protect themselves and to protect others.
When this comes up in conversation, I know at least from conversations I've had, two of the types of businesses that tend to come up most often are restaurants and gyms. So I don't know if you've been hearing those questions as well, but I wonder for gyms in particular, can you give some clarity in terms of what recommendations you're giving people when it comes to wearing masks while they're working out?
So that's a good question, and one of the times that somebody could remove their mask is when they're doing sort of that exercise, right? So, because it can be hard if you're really, doing a fitness routine to be breathing through a mask, right? So that is a time that somebody could temporarily remove their mask. So what we generally say, and a gym or a restaurant who still sort of unclear on this, we have information on our website, but also they can phone us, and we can provide that sort of support about how it really fits in their context, because even gyms, the way they're laid out and what they need to do can be different in different circumstances. But when it comes to the masks for both of those, the restaurants and gyms, we would generally want people to be wearing that mask or face covering when they're coming in, when they're walking through the facility, when they're in the change room, when they're signing in the reception area, for example, and when they're going to their machine or the equipment, for example, or their table in the case of a restaurant. And at that time, they would be able to remove the mask to, for example, if they're sitting in the restaurant, and going to eat, for example, that they wouldn't have to be wearing the mask. But if they were to get up and move somewhere, then they would put that mask back on. And similar for the gym, when they're at that particular piece of equipment that they want to use, they can remove the mask and then put it back on as they, return to the change room or leave the facility.
Are there any particular types of masks or face coverings that you are recommending or not recommending?
Yeah, I think what I would recommend is, that people have something that works for them, and so what they're comfortable with. So, you really want to have one that fits on the face properly, that properly covers the nose and mouth. And I think everybody's going to maybe have a different sense of what's going to work best for them in that. And, you want to make sure, those problems, like if you wear glasses like me, that you're kind of managing about how that they might fog up. I know I've had to adjust my mask so that it doesn't fog up my glasses, and I was able to do that. So I'm, that's something obviously that works for me. But I think that's the biggest thing, something that sort of covers mouth, nose, and chin, and there's not gaps, and that it's working for that person. And people might need to try different options. So I'll leave it at that. But.
Okay. The policy was implemented at a time when I believe at that time there were no active cases. I think we're at 1 in the district now. Yeah. So very low. What would it take in order for this requirement to be lifted?
So I think it's, the reason why we have this now is I think we're with the reopening, of course, even though we have one known active case at the present time. But what we see in other jurisdictions for sure is that with reopening, we see more cases and more spread of the virus and outbreaks happening. And that's really, I'm watching really all across the country in the different jurisdictions. So, it is really important that we have this measure in now as an additional measure that we can protect ourselves, protect our communities from this virus and ourselves against this virus, because we want to keep it low, and it's very easy for this virus to get ahead of us, where it's harder to recover once we have broader spread. In terms of when I would take it off, it's kind of like the whole, when we... It kind of depends on how things go over the fall when we do expect the virus to circulate more. We would really like to come to a place where we have more knowledge about this virus, about what is effective in reducing spread, and that we have all of those measures in place, that we're monitoring it very closely, and we could potentially pull back on some of the measures or other measures that are in place when we know that this virus is well controlled and not going to kind of increase again. And unfortunately, I think we're still fairly early in many ways with this pandemic, especially with the approaching fall and winter season. That so that's a bit challenging, and we could look forward, to potentially a vaccine being available. And that would be one way that we could better control this virus if we had an effective vaccine, for example. And at that time, we could lift, for example, it might be quite reasonable to lift a masking order when people were getting vaccinated, for example.
Dr. DeMille, really appreciate your time this morning. Thank you so much.
Thank you very much. Okay.
Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit. District